Hey guys, I'm back, and it's so good to be with you. How have you all been doing? These are difficult times in January. It's really cold. Our kids aren't getting out, and school's starting for some and not for others. It's difficult around the country. I take care of patients from all around the globe, and everywhere they're dealing with COVID-19, the pandemic, lockdowns, differently. And it's seems to be surging, as you probably have heard on the radio, the news. Okay, that there are lots more cases, and whether the lockdowns are working or not, I'll leave that for other people to look at the data and make decisions. I think right now what I'd like to do is look at our children on the autism spectrum being part of families where there is COVID 19. In fact, I had today a family where dad and mom tested positive. Both of them just with the sniffles, maybe. Mom wasn't even symptomatic, but she got tested. Dad only got tested because there was a coworker where he worked who tested positive, so they did that. But he's just got the sniffles. But they have a 70-year-old grandma who lives with them. So the question she was asking me was, what do we do? What do we do? So I thought I'd talk about that today on our program. And what do we know that's different than, say, what we knew in August, which is certainly different than what we knew in April and before then. So we do know that the COVID 19, the SARS virus, is very difficult to manage in our elderly population. They have a very hard time with it, and it tends to cause the lungs to fill with fluid, and they can't breathe, and then they pass away. And we also know that if there's more than one condition that that person has, they're going to have more problems: high blood pressure, type 2 diabetes, obesity, and we've gone through this before. And that's still the same. We still see that as risk factors of having a more difficult disease. We do still know that our children, for whatever reasons, are not having a hard time with the disease. In fact, they rarely get it, but I've had some children who do get it, and I've only had to treat one specifically. The rest of their symptoms were mild enough, and it was no big thing. So that's really good, including my patients in Italy. So we also are seeing the the changes of the virus. The virus is changing itself a little bit, and that's what viruses do. So what do we know now that's different? A few months back, there were many physicians talking about using hydroxychloroquine with azithromycin. Steroids have recently been added to the regimen in the ICUs. And I've been talking about treating this as if it was kind of like an inflammatory response in the lungs, and you give them an anti-inflammatory like steroids might improve the outcome. And sure enough, the data supports using steroids. So almost overnight, that becomes part of the regimen. But people are still having a hard time, and like I say, these special groups, there's still a higher death rate among them. So what are the groups? Well, the line seems to be 60 or 65, depending on what you read, and older are going to have a risk for a more difficult time with the disease. But they may not either. Okay, it just depends on, are they taking vitamin D, as we've talked about? Are their levels up? Are they taking zinc? Are they taking quercetin, an anti-inflammatory that's natural? How about vitamin C, vitamin D, the zinc? These are all things that help our immune system make an assault less dangerous. And we should all be taking that generally. Anyway, that comes from my kids that I have been working with for many years now, decades, who have compromised immune systems. And their immune systems do a whole lot better when they're taking these supplements. So it makes sense that whether it be influenza or a cold or SARS, right? Now, the new thing that seems to be out there, again, not so much what doctors say, but what the data and the studies show. The data and the studies show that there is a major shift in your response to COVID-19 to the point where either you don't get it, or if you do have it, it's pretty much a very mild disease, or it just miraculously cures it. The data shows this, not an opinion of mine or an opinion of a doctor that I follow. It is a medical opinion. And that medication that you might be hearing about is something called Ivermectin. And Ivermectin is something that I use routinely on my German Shepherd once a month to keep him from getting heartworms. It's an antiparasitic, and it was developed and brought to market in 2015. And the two guys who developed that actually got the Nobel Prize for that. It's been used all around the world as an antiparasitic agent, but it also has antiviral properties. And the antiviral properties just happen to coincide with COVID-19. So the studies are showing, and they've done them, like the one that was recently done in Argentina, where they gave a group of high-risk healthcare workers ivermectin prophylaxis, and they gave a placebo to the other group. And guess what? The other group, 58% of them got COVID-19. 0 of the group that got the ivermectin developed COVID virus. So, I mean, that's just one study, but there's multiple data out there that show that there is marked efficacy in both preventing the disease as well as treating the disease. So that's really interesting. Now, this may be our last Facebook presentation, because mentioning ivermectin and COVID-19 might put me in Facebook jail. So if that's the case, I want you to follow us on MeWe. And let's see, it's mewe.com, mewe.com/mendingnaturally. Or you can sign up for my newsletter at mendingnaturally.com so we can stay in check. You can always find these, for now, on Vimeo. But I'm going to be presenting to you today the data that supports the use of ivermectin prophylactically. So this family that I was just talking to about, that I was speaking with earlier today, where they have the grandma living with them, and dad is positive and slightly symptomatic, mom is positive and not symptomatic, and the children are not symptomatic at all. I suggested, at the very least, you should give grandma the prophylactic, and the two of you might think about taking ivermectin, and we'll see what they decide to do. I hope they're watching this presentation. So anyway, we have a medication that's been used. The medication was discovered in the mid-1970s, but it was the two people who actually discovered it in 2015 were given the Nobel Prize. So it's been around for quite a while. It's had about 3.7 billion doses distributed globally today. Because remember, in third world nations, one of the biggest things that they have problems with are parasites. So this is kind of like a deworming, debugging kind of medication for most people. Over 50% of the population in sub-Saharan Africa take the medication routinely, including infants, children, and pregnant moms, right? So it's been shown to be very, very safe. The margin of safety on this medication is incredibly safe. The NIH has not, ready? The NIH has not woke to this, okay? They're still saying that regarding the use of ivermectin in treatment of COVID-19 should only be done in a clinical trial. But that was done in August. That statement was made. They haven't reviewed the new data yet. And I think once they do, they'll come around to it. So it is an FDA-approved medication. This is just, if you will, repurposing the medication for something different. And that's very true of many medications that we use. For example, one medication that came out as a heart medication, when they gave it to men, they grew hair, called Rogaine, right? So they said, oh, we can make more money as a hair tonic than a heart medication, so they repurposed it, and now we use Rogaine for growing hair. So the idea then, whether it be the azithromycin, the hydroxychloroquine, and now ivermectin is to find a medication that's inexpensive, that's already available widely in really generic form, that's got a safety profile that's a mile wide, and it's already been used in infants and children and pregnant moms, and it's very, very safe. So why wouldn't we want to try and use that? So anyway, what we have seen from the data that is statistically significant, again, not my opinion, but the data shows that there's a faster time for viral clearance. In other words, you get rid of the virus really fast. If you are hospitalized and you get placed on ivermectin, you'll be there much shorter, fewer days. There's a higher rates of clinical recovery compared to a group that does not get them. And 75% improvement in survival rates. 75% improvement in survival rates. So it makes you wonder, had those people, instead of getting diagnosed with COVID and sending them home and seeing if they get worse and if they do go to the ER, or sending them home with ivermectin so they get started the treatment therapy sooner, would we not even be talking about survival rates? It was just a bad cold, okay? The mechanism of action is likely to both be antiviral, but it's also showing to be anti-inflammatory. It has a lot to do with changing our cytokine profile from pro-inflammatory to less. So it may have actually other roles in my practice beside what we're talking about, because I have kids with lots of parasite issues and lots of inflammation gone wild. Okay, the inflammation gone wild. I should do a talk on that one and how we're going to manage that. All right, so the conclusion then that we can do is that ivermectin has a strong, convincing data showing both the efficacy in preventing infection and the transmission of COVID-19, in other words, prophylaxis, as well as treating mild, moderate, and even severe COVID-19. So even if you know somebody who's getting along in the disease process, it's not too late to give it a try, okay? Given the risk-benefit ratio. Whenever we make decisions in medicine, we're always considering risk and benefit, because everything we do has a certain amount of risk. This medication has very little risk and potentially a whole heap of benefit. So why wouldn't we? I mean, especially if the patient's in the ICU. It's like, let's throw a Hail Mary, but instead of just saying words, why don't we just put them on some ivermectin and see what happens? And that's actually been done, and the studies have been done, and it shows there's decreased mortality. So it's a win-win. All right, so I have, on the website here, I have put a link to a testimony for the Senate conference, Dr. Corey, who goes over this data in more detail than I want to do. He's got the slides and everything. What he's trying to do is convince the senators to write a letter to NIH to review this current literature, and perhaps maybe even have them make a recommendation to physicians all around the world to incorporate ivermectin. But right now, as you know, it's hard to get physicians to recommend zinc, vitamin C, vitamin D, quercetin. Really? So I don't know how well that's going to work. These doctors did not consider that part of the treatment plan. Okay, they're just looking at ivermectin. So you can imagine then, if they are understanding ivermectin and its relationship with vitamin D and zinc and all, you might really have a super winning combination with that you guys are privy to, but most of the medical world is not. They're not even thinking about ivermectin or hydroxychloroquine or azithromycin. We're well beyond that. Okay, so definitely, if you are in an area that is being inundated with COVID cases, I would definitely go ahead and do that. Now, as far as the Prophylaxis Protocol, this group, again, it's the FLCCC Alliance. Okay, so you can actually go to their website. They've actually published a prophylaxis protocol as well as an early outpatient protocol. And they did include, not the studies like from Paraguay or Argentina or Mexico or here, but they actually included, and I'm so happy to see that, vitamin D3, vitamin C, quercetin, zinc, and melatonin, because melatonin is an anti-inflammatory. And they give two protocols, and you can see this on their website, so you don't have to take notes. They give 2 protocols, one for prophylaxis and one if you've got the early outpatient protocol. And they even have a post-COVID-19 exposure. So for example, I don't want to get it, prophylaxis. I wasn't really doing anything, and my wife developed it at work, and now as post-exposure, because I've been exposed, I got the prophylaxis, and then of course what to do. So it's all right there for you to look at. Now, this again is not an op-ed. This is not opinion. This is not what I think. This is what the studies are showing, and that's how we used to do medicine. Is that we'd have studies that demonstrate a clear-cut advantage to doing this, or not this, okay? And but now it's kind of what we feel. So when the NIH, for example, said they're not going to recommend using this except inside clinical trials, that was an opinion, an expert opinion. The expert opinion was made not based on data, but his opinion. And because of these opinions, unfortunately, some people may have passed away when there was some good data showing that this can be prevented. So anyway, that is what we have going on there. So let's see if there's some questions. I had some questions that kind of tie into this. Andrea asks about her daughter who is 16, and she's got depression, and she was thinking about taking the COVID vaccine. The link that David put on the site here, I think she should watch, you should watch the link of this testimony of Dr. Corey. It's presented in such a way that a child could understand, because he was talking to senators, so we wanted to make sure they had a very clear understanding of the science and the medicine behind it. So this is a really good primer of what we know, and perhaps then when she considers, as we do in medicine, risk-benefit, risk of a new vaccine, because everything has risks out there, right? Even a peanut has a risk. Some people aren't going to do well with a peanut. Everything has risks out there. A shot of penicillin, a cup of coffee, everything has risks. So it's always risk-benefit. The risks of a vaccine versus the risk of ivermectin. And we just as adults, we can actually contemplate these risks and then make our own personal choices, what we want to do, for as long as we're allowed to make personal choices. Okay, so I think that would be good. So for your daughter, have her watch the video and perhaps get on board with those supplements and consideration of ivermectin. Or she can choose the vaccine if she wants to go that route, knowing that there's some unknown risks there too. Jonathan asks about viral spread, and they spread differently. Different viruses have different mechanisms of spreading, but generally they are not sitting outside waiting to get you. Okay, so when I see joggers running with masks on and gloves, they're not going to get that from the trees. Okay, they're not going to get that from a car that's passing by. That's not how viruses pass. Usually you need some close contact, and everybody talks about social distancing 6 feet. Again, that's an opinion. Viruses can spread more than 6 feet. It's not like they hit the wall at 6 feet and then go boo. They're aerosolized. They're very, 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 very small. So they kind of stay suspended in the fluid mass we call air. Okay, and they have a capacity to go up into the ventilation system, and because they're so thin, they'll pass right through those filters in the ventilation system and get blown out. Okay, so that's how they spread. They can spread on hard surfaces too, but that's a lot rarer. It's mostly person-to-person transmission, whether it be a sneeze, a cough, that kind of a way of passing, and that's why they were talking about you should not sing, you should not talk, you should not. That's the main way of doing that. So I'm not a big fan of putting all of those lotions on hands. They dry out the hands, and they get absorbed by the body too. So I don't know if that's as effective. Again, looking at the data, does that prevent? It prevents bacterial transmission for sure, but the virus transmission, that's more of an expert opinion as opposed to data driven, as far as I know. Okay, So let's move on here. Let's see what we got here from our families. Melody's on board. Hi, Melody. And let's see here. What do you think about kiddos taking the COVID vaccine, especially those who have the MTHFR mutation or genetic deletion? So you really do want me to get taken off of Facebook and put in Facebook jail, right, with that answer? Uh, I think what we have to really consider, again, risks, benefits, and the data that's driven. I've not seen any data that shows that people who have taken the vaccine are 80% less inclined to get COVID when exposed compared to the placebo group. I mean, we just don't have that kind of data yet. The data that's now coming forth, I think in California, has shown that 3 cities have stopped giving a form of the vaccine. I don't want to use names because there was a high risk of anaphylactic shock to that. So I think as we increase the number of the population that gets the vaccine, we'll have a better idea of the risk-benefit ratio, especially with time. So I'd be very careful, and especially about children. Remember, the easy part here that will keep me on Facebook is it's not recommended for kiddos under 16, since you used the word kiddo. So we're not going to be rushing off to give our 5-year-olds the vaccine, not for a while, okay? But my wife read a report last week about LA Unified School District saying that you're not going to be able to go back to this school without the vaccine, but they didn't mention ages or anything like that. So they're working now on 12 and above for vaccines. The studies have not gone to the FDA for approval for 12 and up, but they can't make a mandatory recommendation if that target group hasn't been tested. So I think you're still, you have some time to watch what's happening with the vaccines, both in its safety factor and then its effectiveness in preventing disease. We don't know that yet. I haven't seen data yet that shows 2 groups of people, one group vaccinated, one group not vaccinated, how many COVID cases are they getting? You know, I mean, the ideal group would be they got the vaccinated, and out of 5,000 vaccinated patients, 0 got the COVID. Now, that's pretty substantial, but that doesn't happen, and it didn't even happen with our MMR vaccines or anything like that. Okay, good question. And Angelita says, is ivermectin by prescription only? Yes. Okay. Yes. Thank you so much. Let's see, Althea, thank you for so much keeping us warm, especially for our amazing special kids. Our kids are amazing, and they are very, very special, and they are very challenging. Some of our kids never get sick, and they've never been on an antibiotic, and some of our kids live on antibiotics and are always sick. They are such a diverse group, right? I mean, if you have a child with special needs and you look around, how many other kids you know with special needs are like yours? They're really different. They're really different between their ability to develop a disease process, or they're bulletproof from diseases. One's got language, one doesn't have language, one sleeps all night, one sleeps 3 hours a night. I mean, they're all so different, right? Let's see here. Jenny asks about the Pfizer COVID vaccine. Does not keep you from catching COVID, it just keeps the symptoms at bay. Is that true? Again, we don't have enough data to say yet from a study of that particular vaccine. That's okay. So first of all, that seems to be what's out there, but the data is not strong enough to say one way or the other. I mean, that is one form of being vaccinated, is that if you get the disease, it's really mild as opposed to severe. But then you can get the disease and have a mild case anyway, just like those 2 who didn't get the vaccine. So what you have to compare that to is the unvaccinated group. You see, that's your only control, because if you said, oh yeah, I got the Pfizer vaccine, but I got COVID-19 and I had a mild case. Well, you could have had a mild case anyway, whether you got the vaccine or not, just like that family I started out with today. both mom and dad. Mom's asymptomatic and she's got the disease because she was tested. Well, she's got the RNA in her nose. Doesn't mean that she's got the disease. She just has the exposure to it. Doesn't mean she's going to get it, right? That's the challenge. That's a different topic. But dad has disease. He's got the sniffles. Not a sore throat, not coughing. He's got the sniffles and I think a low-grade temperature. Now, they did not get the vaccine. So if it goes away, you see how you have to compare it? You have to always compare the two groups. You have to say, well, if you're going to get it, it's going to be a lot milder. Really? Let's compare two groups, 1,000 people who got vaccinated and 1,000 people who didn't, and compare the disease prevalence in those two groups and the disease severity in those two groups. And that's how you look at it. And to my knowledge, I have not seen those studies yet. Okay, so it's hard to say that. Angie says hello. Hello right back to you. Okay, let me see. Is there anything else out there? Okay, so if you have more questions about this, send us an email, and I'll be able to get back to them next week. And what are we going to talk about next week? Why don't you send me some ideas of what you'd like to hear about next week, and I'll be glad to bring it to you live again. Or you can watch it at your convenience on Vimeo, especially if I'm not here on Facebook anymore. All right, guys, is there anything else? Let's see here. Yeah, I got a couple more questions here. Jenny says, sounds a lot just like the flu vaccine. Thank you for the answer. Again, it sounds like, it feels like, from science, from data-driven science, we don't have those answers yet. And I like to be a little bit more analytical about these things. So when I share something with you, it's based on medical science, what we're doing. And things have gotten so darn political that if you say something that's politically not in line with what's out there, you run the risk of being silenced. So we've just kind of got to be careful. So I'm going to hide behind the scientific numbers and say, yes, it's there or it's not. So it will be there eventually, maybe a year at this time. We'll have some good data points from different countries, not just ours, but different countries that will show us. If you watch that video, you'll see some great data points from different countries like Paraguay and Mexico, and see what's happening there. Okay. Natalie writes in, how do you manage psychological health? You deal with so much human suffering, but always look so calm and peaceful. It's the way God wired me, guys, okay? I deal with all of this stuff for over 30 years, and I do get tired. I mean, by 9 o'clock answering emails and messages, I'll tell my wife, I'm out of love here. I can't answer another email. We'll just have to wait till tomorrow. But it's just the way that God blessed me to be able to deal with what's going on. And I mean, I can still well up with tears when I think of things that are happening with, happened with my son or whatever, and it gets kind of touchy and emotional. But generally, I'm able to just look at things as they are and try to circumvent. I ache when you ache when I can't get a kid better for some reason. The kid's constantly spitting or the kid's constantly doing this, and I'm trying to figure out what are we missing? What are we missing? And I rejoice when I get cards and letters of pictures of kids graduating, kindergarten or now college or high school, and they were autistic when they were 3 and nonverbal, and now they've got a girlfriend, or they're going. I have one kid who just joined the Marines. His obsession as a child with autism was to join the Marines, so that was his driving force. We opened up the doors, metabolically, so he can to reach that, and Mom always thought it was just a dream, and he actually qualified as getting into the military. He made it through boot camp, Marine boot camp, and he's actually a Marine now, and loving it, and obviously normal, because if you have a medical record that says you have autism, they're going to really scrutinize before they bring you in. So it is possible, and I rejoice with those, and I anguish with those kids who were struggling to get better, because every child has various degrees of injury, metabolically, immunologically, neurologically, I mean, it just everything, rheumatologically, the autoimmune diseases. So we have to put those pieces back together. And so I've been able to do that. And for me, it's a great reward. It's hard work, but it's a great reward. I get to read a lot of really cool stuff. It keeps me busy. If you think about it, just a general pediatrician, what are they doing? They're doing coughs, colds, congestion, vomiting, diarrhea, diaper rash, little asthma, ear infection. That's about it. This goes much, much deeper, so it keeps me intellectually engaged and excited to come to work every day and excited to see your kids. I don't get tired of it. All righty. Anything else here? Very cool. All right, guys. Have a great rest of your week. Again, if you have a special topic you want me to go through or go over, I would love to do it for you. If not, I will pick something intellectually stimulating for next week's talk. Have a great week. Love your kids right where they are. And just keep the faith, keep the hope, and we'll talk to you soon. Take care now. Bye-bye.